Hi everyone, I am Gavri PS, lecturer, Department of Radiography, Global College of Allied Health Sciences. Today we are going to discuss about the topic coronary angiography. First, what is angiography? Angiography is an X-ray imagination technique in which we will be imaging the arteries by injection of an radio by contrast media into the blood vessels to visualize the abnormalities. That is, it can be captured by images through a digital fluoroscopy method. Usually, this angiography method is done by means of interventional radiologist, anesthetic, cardiologist, radiologic technologist, physician, and also an nursing assistant. Usually, for the visualization of the vessels, we will be inserting a catheter into the specific vessels for the contrast administration. And the common method which we use for introducing catheters is Seldinger technique, and it was developed by Dr. Seldinger. And the common vessels which we used for catheterization is femoral artery, brachial artery, axillary artery, and radial artery. So now we can look about the coronary angiography. Coronary angiography is a special X-ray examination of the blood vessels or the chambers of the heart. A very small tube, that is a catheter, will be inserted into the blood vessels in the upper thigh region or on the arm. The tip of the tube will be positioned either in the heart at the beginning of the arteries supplying the heart, and the special fluid, that is a contrast or a dye, that will be injected. This fluid will be visible by the X-ray, and the pictures will be taken in a continuous random method, and these images will be called as angiogram. So there are some of the indications for the coronary angiography, and the indications will be acute MI, unstable angina, chronic stable angina, that is controlled by an uncontrolled by an abnormal stress test, ventricular arrhythmiasis, left ventricular dysfunction, valvular heart disease, preoperative coronary assessment for cardiovascular surgery, periodic follow-up after cardiac transplantation, chest pain, narrowed arteries, breathing difficulties, so angioplasty or bypass surgery, etc. So there are some of the contraindications. That is, the contraindications are the which cases for that we can't do this angiography study. That is, if the patient has conditions such as coagulopathy, active bleeding, malignant hypertension, acute or chronic renal failure, severe anemia, that is the HB, that is blood level less than 10 gram per deciliter of blood, or electrolytic imbalance, fever, acute systemic infections, or uncontrolled rhythmic disturbances, uncompensated heart failure, transient ischemic attack, or the patient is unable to cooperate or do not have the desire to do the process, etc. Or some cases there may be allergic reaction to the contrast media. So next is about the patient preparation. How do we prepare the patient? Usually we have to maintain the patient to be in a fasting for 6 to 8 hours. That is, this is maintained so that the patient do not feel any vomiting sensation during the contrast administration or after the contrast administration. And allergic reactions of the patient should be checked properly, and the IV line will be inserted for transferring of the medicines, and the consent form should also be signed by the patient or the attendant before they are starting any of the procedure. So what are the requisites which are required for a coronary angiogram? First is the cath lab. Next is puncture needle, introducer, short guide wire, cordless sheath with dilator, left Judkin catheter, right Judkin catheter, and also about a contrast media. These are the main requirements. So, what are the steps we follow during the angiography? First, we will be writing a consent form. That is, fasting will be maintained for the patient at least 4 hours. Then pre-cath investigations will be done. We will be selecting the arterial access point. In the case of wrist or groin, we will be shaving that area and we will be opening the IV line, and it will be connected with the cardiac monitor, and we will be giving IV sedatives or by means of oral or IV. Then after these, we will be maintaining the patient to lie in a angiographic table, and the local anesthesia will be administered that to numb the area, and a thin catheter will be inserted into the artery, and by means of an x-ray guidance the catheter will be inserted to the coronary artery, and the contrast dye will be injected by means of this catheter, and this will be making the coronary artery visible on the x-ray images, and the series of this x-ray images will be taken to check the blood flow in the coronary arteries, and the doctor will be finally checking the patients for any blockages or any narrowing in this area, and the procedure, and after the completion of this procedure the catheter will be removed, and we will be using a pressure or a closure device to stop the bleeding. So after this procedure, we have to check some of the patient care. So it is that the patient should be asked to rest for few hours. If the puncture site is on the femoral artery, the patient should be lying only on the flat, and we have to monitor the patient for any bleeding, pain or reactions due to this contrast media. And the patient can be discharged later based on the patient's recovery methods. Then after this also has some of the complications. The complications will be MI, stroke, renal failure, aortic or coronary dissection, cardiac rupture, air embolism, arrhythmia, peripheral vascular damages, and sometimes it may also have a condition such as death of the patient, and sometimes there will be an irregular heartbeat, and they'll be having sometimes the patient may have heart attack, stroke, can cause allergic reaction because of this dye. There is a contrast, there may be bleeding or bruising. So, and this coronary angiography is a golden standard, that is for visualizing the coronary arteries, and the early detection of any of the coronary blockages can save the patient's life. So we have to detect, or we have to check whether the patient has been in condition and has to be rectified earlier as possible, so that we can save the patient's life. So that's all for today's class. Thank you.